حاول ترفع رفعة تمام. ارفع راسه شوية.
We took the Johns Hopkins University study globally that estimated the impact of COVID on populations accessing primary health care and modeled it for the Middle East and North Africa. And in our estimates, there's going to be additional children who will die if populations don't access primary health care. It goes from a low of an additional 11,000 deaths below the age of 5 up to 51,000 deaths below the age of 5. The countries that concern us most are countries that already had fragile health system where the immunity of the population was compromised, so places like Yemen, like Sudan, like Djibouti, but this is true in all countries in the region. So firstly, it's to get information out there to the population about what's most likely to affect your child is preventable. It's neonatal sepsis, infection at birth. It's pneumonia. It's the treatment you need to address severe malnutrition. It's preventable diseases that can be addressed through immunization, measles, diphtheria, polio. Getting that information out there to the population. Second, working with the frontline health workers so that when they interact with a child and its mother or its father, that the interaction is minimal. There's ways of treating severe malnutrition, of immunizing a child, of addressing sepsis, which involves minimum physical contact. So there is no transmission from either the frontline worker or the family members. And then thirdly, making sure that the health workers do have the personal protective equipment. It doesn't have to be the medical grade that you need when you're treating COVID cases regularly, but minimum gloves, cloth mask that a health worker can have at their disposal. This is what needs to be in place for this to move forward, and this is what UNICEF is helping countries in the region with.
صح حالي
One of our key concerns has been countries making the decision to suspend immunization campaigns. So up to 15 million children were at risk of not receiving immunization against measles and polio. We're pleased that several countries in the region have now made a decision to reschedule those campaigns and put them back on the calendar, and we urge those countries to go through with those plans. It's important that children are immunized against preventable diseases. It's possible to do this in a safe manner, and these campaigns need to continue.